Microbiology. What is it, and what does microbiology have to do with you? This field of study is a key part of our world, from human and animal medicine to understanding the environment. On this show, Minerva Garcia, a practicing microbiologist, swings open the door to her lab to welcome you into this intriguing world. Now, let's meet Minerva, the microbiologist.
Welcome all to my show. Meet Minerva, the microbiologist. My name is Minerva A. Garcia. I'm currently the Social Director, Microbiology at Jacobi Medical Center, New York City Health and Hospitals Corporation. I am your microbiologist. Now again, microbiology with the microbes welcomes you in, and so does poetry with creative lines. In today's show, I'll be talking about the following topics: how to reach unvaccinated people, my personal experience with COVID-19, difference between rapid testing, PCR, and antibody tests, in other terms, COVID-19 variant strains update, national and international news. So there he goes, an analogy of a poem, discussion. Our goals as human beings to sustain our ecosystems, our planet, and most of all, to continue to strive, living independently as best as we can, enjoying our lives. We know summer is on its way. We are leaving the winter behind, and for those lucky of us who've been vaccinated with COVID-19, restrictions are being lifted. We can all breathe a little free as the CDC guidelines for vaccinated individuals seems uplifting. Therefore, we all got to take on responsibility and get vaccinated if we are to take control of this COVID-19 pandemic heads on. We got to get vaccinated, all of us. It's crucial part of the United States strategy to curb the pandemic. We know since COVID-19 vaccine distribution began in the United States on December 2020, 290 million dosages has been administered, fully vaccinating over 132 million people, or 40% of the total population of the United States. This is all great news for now, but we need everyone's cooperation to reach 100% success rate. Since we are facing the many challenges together, let us not leave anyone behind. Those who have been vaccinated, get the word out to all your friends, families, co-workers, and all. We know vaccines save lives. We got to love ourselves and everyone as a nation. We got to start again with increased hopes and start dreaming again. That is so important for our health and mental state. Let's hope we have faced the many challenges. The time will come to feel relaxed, once again enjoying ourselves with our beautiful sun and getting our feet wet as we think of the blue waters in the beach. With this in mind is where poetry comes in. And I'd like to bring you all into my world of microbiology, where microbes are discussed and poetry expressed. In support of trying to get everyone vaccinated, I am dedicating this poem titled, When You Plant a Seed with Love. Plant a seed with love, you'll see it grow. Plant a seed with love, you'll see a beautiful garden multiply. Plant a seed with love, you'll witness food from the above. Plant a seed with love, you witness birds and bees smell God's trees. Plant a seed with love. You'll feel your eyes harmonize with picturesque grace. Plant a seed with love. You will not be sad for long, for it's a wishful view in youth. Plant a seed with love. It's your heart that will thank you for the feelings of lightness. That is, you have a heart. Plant a seed with love. Not yesterday, not tomorrow, but today. For tomorrow, you'll find bountiful fruits. I can also add, on this May 28, 2021, you've got to love yourself, family, friends, your fellow men, and so there can be forth many springs to be witnessed by our future offsprings. So now let's get started. How to reach the unvaccinated people. We know that this era of COVID-19, if you want to travel from country to another country, you will need a negative PCR test. One of the tests you can choose is a real-time PCR test, which is referred to as a reverse transcription polymerase chain reaction. It is the most recommended type of test as is effective in tracing infections for people with influenza-like symptoms, just like COVID is. So how can I convince the importance of vaccination to everyone? How do I come up with suggestions or any friendly advice to convince people to get vaccinated? That is the question. I, as a healthcare worker, was vaccinated in the 3rd week of December, being one of the first of the hospital employees. I may witness that this vaccine is safe, effective, and proven to me protection, and that I will not get COVID-19 nor pass it on. This is a huge relief and make me feel really safe. I cannot stress it enough to the public. Please, please, all get vaccinated to control this pandemic of COVID-19. I'd like to convince all those audience listening to this podcast. Please note that this vaccine is safe with minor side effects. The benefits outweighs the side effects. This vaccine will not alter your DNA, as some believe and have speculated. These are purely false claims. Pfizer, Moderna, mechanism, and for these vaccine is mRNA, which is messenger ribonucleic acid, does not alter your DNA. The reason being is because it never enters the nucleus of the cell. The mRNA instructs your body to make the spike protein on the virus, which triggers your body to develop antibodies against the spike protein, COVID-19. Other vaccines are also safe with minor side effects. You can consult your doctors for further information and for your safety. That's my recommendation. Vaccinating against COVID-19 is a crucial part of U.S. strategy to curb this pandemic. Also, should follow through the World Health Organization. Since COVID-19 vaccine distribution began in the United States on December 14, more than 290 million doses have been administered, fully vaccinating over 132 million people, or 40% of the total U.S. population. Great news. This is great progress and news update. Everyone should become familiar with the CDC, which is Center for Disease Control and Prevention guidelines. It's crucial and important to remain informed and updated, especially anyone wishing to travel. A southwestern Ohio woman won the state first 1 million vaccination incentive prize, while a Daytona area teen was awarded the first full ride college scholarship offered by the program. That's the state which announced on May 26th. That's great news and encouraging. The winners whose names were drawn from more than 2.7 million entrants were selected in a random drawing on Monday, May 28, 2021, and had their information confirmed before the formal announcement at the end of the Ohio Lottery Cash Explosion TV show. The drawing seems to be achieving its intended goal, getting more people vaccinated. Vaccination rates seem to have jumped 33% in the state in the first week after the lottery was announced. Wow, that's a plus, and a big wow. In addition, reports of the New York Daily News by Andrew Cuomo, New York State governor, yesterday announced 5-week drawing in which 10 vaccinated people in a week from ages 12 to 17 will have a chance to win free room, board, and tuition in a state or city-run college or university for a full 4 years. Cuomo cited that the low rate of vaccination and comparatively high rate of infection among young people in the state are the reason for this strategy. This is another wow, great news. Benefits of COVID-19 vaccine on patients who have symptoms of hearing loss and taste can also improve through vaccination. It has been revealed that patients with COVID-19 symptoms have found relief after receiving COVID-19 vaccine. Example, improving their hearing and taste loss. That's all great news. A UK study found which support this finding, indicating that after a vaccine person with long COVID-19 can start to feel much better. But more research is needed in this area to help people and to convince people. This is all very important. I am sure we'll be seeing more studies and more info coming out within the next couple of months. When people get the vaccine, it's okay to feel some side effects. This is all good because this means your autoimmune response is working with you and not against you. I say again, it's important because your autoimmune response is working for you, not against you. Your immune system is your friend. When a person gets COVID-19, it affects their autoimmune systems by causing inflammation, usually start as an upper respiratory infection that leads to a lower respiratory infection, where bacteria begin to strive, causing inflammation. Treatments are required at this point because bacteria are striving in numbers. Usually, hospitalization is required. Since it might have difficulty breathing, these infections could be yeast such as Candida albicans, Candida glabrata, Candida parasilosis, Klebsiella pneumoniae, Streptococcus pneumoniae, MRSA, etc. Final note. It's important to know that all pregnant women should get vaccinated. We know these vaccines are safe so far with minor side effects. Know that your fetus is protected from harm since it's in a bubble. Some of the antibodies can get into the placenta, serving as protection for the fetus. All great news! However, you must consult your physicians or clinicians for your best decision, since every woman are facing different challenges with their health. So these are my advice. My personal experience with COVID-19. As I registered online on our hospital designated website, I was one of the first employees to get the vaccine. I was so excited to be among the first group to get this SARS-CoV-2 vaccine, Pfizer Bioengineering. I knew how important it was to get this vaccine into my arm. I had to show my staff, family, friends, and my community that it's safe. I had to take the first step to ensure everyone that I could be this person they can trust and run out and chase for questions. This is what really happened. I, being a New York City runner, a marathon runner, and eager to make sure I curved the curve, I had to take on responsibility. I had many people calling, texting, most of all, practically interviewing me. I explained to them, this vaccine is safe, effective, and has made me calm knowing that I'm getting the protection. Therefore, I got calm within this storm. I had to make it my business and be exemplary for everyone. Today, I know I made the right decision, and I hope everyone will follow. Even those who have doubts. Look, I am here, safe and sound. So guess what? Use me as your example. I want the best for everyone. I worked at the very beginning of this coronavirus epidemic. I had to work very closely with this live virus and patient testing. I had to perform validation studies, make implementations, train staff, bring new instruments in to test COVID patients, test samples, and test patients while utilizing personal protection equipment, PPE, using gowns, gloves, facing, covering, and hair for my protection and also for my staff. Testing was performed on the Biological Safety Cabinet known as BSC, the hoods. All surface properly decontaminated with a disinfectant. Look, I am here. I was not afraid. We are qualified lab professionals with a care for patients' lives improvement. Patients are kept always in mind with the highest mindset for recovery of the illness. That means SARS-CoV-2. We are all trained and licensed to perform our work duties without fear. This is what we've been trained to do. And we have done it with pride, with patient in mind always. I recall sitting in the waiting room, filling out the questionnaire when our CEO walked in, talking to all of us and encouraging us to get vaccinated. I took pictures with Mr. Chris Mastromano, our CEO. During Lab Week celebration, this picture I posted in my office. It was well received by my staff and colleagues. It was really fun. Recently, the hospital provided all vaccinated employees with a bag full of goodies to show all of us their encouragement, respect, gratitude, support, and most of all, concerns for all who got vaccinated and encourage others to get vaccinated. I love working at this institution at Jacobi Medical Center, right here in New York City in the Bronx. They have treated all of us and all their employees with such dignity and respect. We are treated as a family with great concern for all of our well-being. This went a long way, as I have noticed. And look, I took notice. I'm still taking notice. This really was and is a nice gesture of appreciation to all the employees who got vaccinated. During Lab Week, all lab workers receive a t-shirt with logo, Lab Workers Get Results Done. We had a dinner, we had lunch, and we had so many prizes that we won. It made all of us feel so proud to be healthcare workers in the laboratory. I know we have their support and they have ours. We got each other's back. So anyone out there questioning why get vaccinated? No, vaccines save lives. Just look at me. I put myself first for patient care. Today, I am here talking to all of you, to my lovely audience. And know that I tested patients with COVID that were positive. So many patients tested positive. When we started, about 90% of our patients were positive with COVID. And look, I never came down with COVID. And as soon as we got the vaccine, I was the first one online. I hope you learn and do the same thing. So please, get up. Don't be afraid. Follow the sun. Every day it starts. It says hello. It says hello. It warms you up and provides the light for you, to all of us, to head on and lead on. Push forward. Head on. And as the crops and flowers to do the same thing, to do their things. We are fed and our eyes beautified with such grace for us to view. Differences between rapid testing, PCR, and antibody tests, and other terms. So now let's get started in my discussion. Let's discuss difference between rapid testing and PCR. Rapid testing is referred to as a rapid test. This test detects protein fragments specific to the coronavirus. It can be done in a clinic, doctor's office, or hospital setting. Turnaround time, known as TAT, for the result is usually very quick, reported within 15 minutes. False positive can occur. If a patient is symptomatic and result by rapid method is negative, repeat test is required by PCR method for confirmation. The rapid test detects antigen. You can also call this rapid test as antigen test because you are detecting the antigen and or protein. This test thinks as method as a pregnancy test. These tests often come as flat plastic card that contains a test strip. The test strip reacts with coronavirus antigens present in the patient's mucus sample, and the strip typically changes color to indicate that the patient is positive. How does it take for the result of a rapid COVID-19 test? Usually takes 10 to 15 minutes in the laboratory. PCR has an excellent sensitivity percentage. Was developed to overcome the obstacle of quickly replicating DNA for research use. It was developed in the 1980s. The PCR lab test is widely applied in medicine, from identifying new viruses to testing for bacterial illness. The PCR reverse transcription polymerase chain reaction. It is most recommended type of test as it is effective in tracing infection for people with influenza-like symptoms. Another virus, as an example, we know COVID-19, we know today. The real-time PCR test sample is highly sensitive compared to the antigen swab. PCR test, being a diagnostic test, is a very accurate, extremely reliable. This test, however, does not tell you if you had the COVID-19 virus in the past, an active infection present. There are times in which it may take the virus a few days to start replicating or spreading throughout the nose and throat, meaning recently infected people. The nose swab may fail to pick up signs of an active infection. It has a sensitivity of 95%, which is great sensitivity rate. Since we know that it is everyone's responsibility to help stop spreading this coronavirus, this responsibility really falls on everyone's shoulders by ensuring we fulfill this obligation by testing for the virus when we suspect we are infected. Also, we must isolate in order to prevent the spreading of SARS-CoV-2. I know when you seek assistance within the medical system, they can lead you to the right track, where testing is recommended. Therefore, you got to be vigilant. You got to stop spreading the virus. Stay at home as much as you can. Avoid crowded places. Wear a mask when you're out of the house. If you're not vaccinated, wash your hands thoroughly and regularly. Convince yourself and others to get vaccinated. Learn the facts. Don't act on fears. Know that when you are prepared, you are not scared. Take this advice. This is why I am discussing these terminologies for the betterment understanding of testing in the laboratory. Terms defined: qualitative test, report of a negative. Is positive or negative, inconclusive, whereas quantitative, you report a number, example 1 to 4 value. False negative is a negative reaction on a test that is not due to an infection with COVID-19. False positive, a positive reaction on a test that is not due to an infection of COVID-19. Point of care testing, for example, ID Now. COVID-19 is a rapid 13 minutes or less instrument-based isothermal test for qualitative detection and diagnosis of SARS-CoV-2 from nasal, nasopharyngeal, and throat swabs. The ID Now instrument has a small footprint and easy-to-use graphical user interface for convenience within a busy hospital setting or near patient testing environments. The ID Now test contains all components required to carry out assay for SARS-CoV-2 on the ID-Now instrument. Point-of-care tests are performed in the ER. It's not an antigen test. It is a molecular nucleic acid amplification test, isothermal nucleic amplification to be more specific. It is not more sensitive than PCR tests that's performed in the laboratory. It's only sensitive for testing patients who are symptomatic. More specifically, those who've been symptomatic within the last 7 days. This is reflective in the ID Now package insert. The point-of-care testing in emergency rooms and/or urgent centers. Example would be ID Now COVID-19. We know that coronaviruses are a large family of viruses which may cause illness in animals and on humans. We know that SARS-CoV-2 is an envelope, single-stranded RNA virus of the beta genus. This virus causing mild to severe respiratory illness that has spread globally. If a negative ID result, negative on ID Now, you are symptomatic, result must be confirmed with another test via PCR methodology, as Cepheid, Panther, and other instruments. Also, negative result from the ID Now should be treated as presumptive and should be confirmed by another molecular test. This is also noted in the package insert as instructed by the FDA back in October. The level of detection known as LOD for both the Panther and the Cepheid test are both significantly lower than that of the aboutthe ID Now, which is why negative confirmation is required for negative ID Now tests. This is what has been instructed to all the staff before this test was implemented in the ED or emergency department for testing. Now, I would like to discuss terms that are very useful in the microbiology, worth mentioning. These are antibody serum for COVID-19, antibody test, also known as a serology test. It's a test that can detect if a person has antibodies to SARS-CoV-2, the virus that causes COVID-19. Usually takes 5 to 10 minutes in the laboratory. Detects or measures the number of antibodies related to infectious disease or autoimmune condition. The type of specimen is blood. It can detect conditions to diagnose an infection, autoimmune disease, example hepatitis, HIV, AIDS, ANA, lupus, syphilis, SARS-CoV-2, disease being invasive. COVID-19 antibody testing, also known as serology testing, is a blood test designed to find out if you had a past infection with SARS-CoV-2, the virus that causes coronavirus disease in 2019. An antibody test can determine whether you are currently infected with the COVID-19 virus. Antibodies are proteins produced by your immune system in response to an infection. Your immune system, which involves a complex network of cells, organs, and tissues, identifies foreign substances in your body and helps fight infections and diseases. After infections with the COVID-19 virus, it can take 2 to 3 weeks to develop enough antibodies to be detected in antibody tests. So it's important that you are not tested too soon. Antibodies may be detected in your blood for several months and or more after you recover from COVID-19. Although these antibodies probably provide some immune antibodies and neutralizing antibodies. Binding antibodies, those widely available antibody, detects whether you have developed any antibodies in response to a COVID-19 infection. They don't indicate how extensive or effective your immune system is, where neutralizing antibodies are not yet and widely available, and a newer and more sensitive test detects a subgroup of antibodies that may inactivate the virus. This test can be done after you test positive for binding antibodies. It's another step to finding out how effective your antibodies are in blocking the virus to help protect you from another COVID-19 infection. EUA, which is known as emergency use only. Many PCR-based SARS-CoV-2 tests have been granted a CDC emergency use authorization to meet the enormous diagnostic in order to meet COVID-19 epidemic and its testing capabilities. The assay utilized different primer probes set in various swabs and transport media. Do all these tests perform equally? And do transport media and condition influence the tests? SARS-CoV-2 molecular test instrumentation used were Cepheid, GeneXpert Express, Hologic, Panther Infusion, Dorian, Simplexa, and Roche Cobas 6800, using nasopharyngeal swab with collection via viral transport media, VTM, which is a pink to red solution. Question. Antibody tests for COVID-19, in which scenarios? Symptoms COVID-19 in the past that weren't tested. Medical procedure done in clinic, example if you tested positive for COVID-19. Diagnostic tests in the past. COVID-19 infection in the past and want to donate plasma and a part of your blood that contains antibodies that can help treat others who have severe cases of COVID-19. A sick child where clinicians suspect multi-system inflammatory syndrome for children known as MIS-C. Antibody testing may be ordered to help diagnose the MIS-C. Many children with MIS-C have antibodies to COVID-19, indicating past infection with the coronavirus. For info on COVID-19 antibody tests, see your physician or clinicians. COVID-19 variant strains. Update. National, international news. What does it all mean? What do we know today? In Australia, COVID-19 numbers are on the rise. Cases are high. In Peru, COVID-19 death total up to 180,764 from its previous number, 69,342. That's bad news. In Scotland, COVID-19 restriction was lifted in some parts. As June 5th, however, the country had tough measures due to recent spikes in the coronavirus cases. The European Commission is suggesting lifting all quarantine obligations on travels within the European Union from July 1st, 2021 on fully vaccinated individuals against COVID-19 who can present a negative COVID test. In India, it has been warned to the public, which has been announced, that all travelers should keep away from now until the situation improves. Due to the COVID-19 crisis scene, it has been warned that every fully vaccinated travelers may be at risk for getting and spreading COVID-19 variants. Everyone should avoid traveling to India. This is not personal, but it's an effective way to let everybody know. Be responsible. Come when the numbers are low and when COVID-19 pandemic crisis has been under control. Globally, COVID-19 death has passed 3.55 million. Sad news. The number of confirmed cases is more than 170.7 million. More sad news. According to Johns Hopkins University, though the true numbers of cases will be much higher, according to our world in data. More than 140.9 million people globally have received at least one dose of a COVID-19 vaccine. Some good news. Also, though this COVID-19 virus was bioengineered in a Chinese lab, are baseless. The idea that the novel coronavirus could have come from nature and instead might have been created by altering a previously discovered bad coronavirus? but several of his main points rest on faculty conclusions. One of the study's main claim is that the genomic sequence of SARS-CoV-2 is suspiciously similar to that of a bat coronavirus discovered by military laboratories in China, and therefore indicates that another coronavirus was used to create the novel coronavirus. It should be noted that two top scientists, microbiologists, Christian G. Anderson and Dr. Sterling Perlman, both microbiologists, immunologists, a branch of microbiology, has made this emphasis. Christian G. Anderson, a professor of immunology and microbiology at Scripps Research, who has studied the origins of the virus, has said, "This simply can't be true. There are more than 3,500 nucleotide differences between SARS-CoV-2 and these viruses." Dr. Stanley Perlman, a professor of microbiology and immunology at the University of Iowa, who studies coronaviruses, the coronavirus reference, ZC45, is only 89% related to SARS-CoV-2. In virology terms, this means that it's very, very distant. Dr. Perlman stated, in order to make the reverse genetics system needed to manipulate the virus and changing its sequence to arrive at SARS-CoV-2 would be virtually impossible, since it would not be known how to manipulate the virus. I say it one more time. Changing its sequence to arrive at the SARS-CoV-2 will be virtually impossible, since it would not be known how to manipulate the virus. Very important, this information that is being stressed. Dr. Li Meng Yan, an author in a newspaper and a virologist, made claims that she had fled China to reveal the truth about COVID-19. SARS-CoV-2 contains a unique furin cleavage site in its spike protein, which is completely absent in this particular class of coronaviruses found in nature, and that therefore the virus was engineered, were her argument. Well, was she trying to get fame? Was she trying to accomplish this goal? Susan R. Weiss, University of Pennsylvania, professor of microbiology, research coronaviruses, stated, "Make no sense in terms of what we know about coronaviruses. Among murine coronaviruses strains, there are viruses with the furin site and strands without, related strands closer than SARS and SARS-2, yet they are all virulent," Weiss said. Therefore, virus being engineered means nothing. One more time, viruses being engineered means nothing. A furin site is a short protein sequence that can be recognized in combat other proteins. Dr. Perlman also said, furin sites are found in many coronaviruses, and finding it does not surprise us in the field. Very important. The furin sites are found in many coronaviruses, and finding does not surprise us in the field. Vaccine tractor. We know today an approximation of 361.3 million doses of the COVID-19 vaccine have been shipped to various states of the U.S. of this as today, of which 290.7 million doses have been administered so far, according to Times Vaccine Tractor. Facts: 40% of all Americans have been completely vaccinated. Hooray! Great news! The global situation is real, and the numbers don't lie. We also know that more than 168.4 million people around the world have been diagnosed with COVID-19 as today, and nearly 3.5 million people have died. Bad news. On May 26, 2021, there were 509 new cases and 12,655 new deaths globally confirmed. Bad news. Therefore, we are still vulnerable in controlling this epidemic. Until everyone gets vaccinated, everyone will be vulnerable. It is upon and up to all of us to make sure you become a champion in stressing all to those you know to get vaccinated. It is crucial to have this understanding in order to stop this virus from controlling all of us. We will take control when all are vaccinated. This is how we can stop this pandemic from becoming a wild beast. Look at this way. If you heard there's a tsunami coming your way, if you have taken covers on a steel building 50th floor, 3 miles away, others remain because they believed it was a myth. They were washed away due to their false confidence. I suggest you all think of this virus like an uncontrolled tsunami coming your way. It has left endless destruction, and still you are trying to pick up the pieces. Know that there will be more coming your way. If you don't get vaccinated, know that the only way to stop it is by getting vaccinated. This is the truth. This is the reality which we all have to face. No, we have to decipher them for ourselves and themselves. You have to feel comfortable with the decision and choices you made. But know your decision will impact your health as well as others. Don't be foolish, nor selfish. Make an intellectual decision and question yourself honestly and wisely. Your logic. Why do you want to get vaccinated? Why you don't want to get vaccinated? Know that your decision will impact yourself, your family, friends, neighbors, and your community. You do not want to be that person that had COVID-19 and became a super spreader, especially to the vulnerable. Also, because you lack empathy. You caused someone death by passing this virus to an elderly person. Think again. Therefore, please think. You do not want to have a guilty conscience. Please all get this vaccine once and for all. We are all in it together. So be smart, be vigilant, take covers, and take this vaccine. Don't run and hide. There's nowhere to go. Please know that if you get vaccinated, you now have this protective wall as an armor that now this virus cannot reach you, nor enter into your body. This is best protection. That COVID-19 is not your enemy, but your best friend. Take this vaccine. This COVID-19 is not your enemy. This COVID-19 is your best friend. It will give you immunity against this deadly virus. Now I give a shout out to my beautiful executive producer, Mary Lou, who has made this podcast possible. Now I conclude the show from the microbial world. Thank you for having me. To my lovely audience, thank you for tuning in and listening. This is Minerva A. Garcia, your microbiologist. Opinion disclaimer. The views and opinion expressed in this podcast are solely my own and my guests, and not of any institutions or corporations. Thank you.